Spinal cord injuries are, a significant cause of morbidity and mortality, and so gunshot wounds that induce spinal injuries account for about 17% of spinal cord injuries, and so it's certainly an important etiology of injuries to the spinal cord and spinal column, and it's actually been increasing in proportion, at least in the United States, and so it's an important thing for us to study. And unfortunately, there has been kind of a paucity of the data, and not really much is known in terms of what the true sort of management algorithm should be. And so our goal was to really look at that and try and get a better sense of things, particularly with a large subset of people. Overall, there were 961 patients of the nearly 32,000 spinal cord injury patients in the database, the National Spinal Cord Injury Statistical Center database. So 961 of those had had gunshot-induced spinal injuries with complete data at 1-year follow-up. And so the overall sort of aim and primary endpoint was assessment of the ASIA scale, which is the American Spinal Injury Association Impairment Scale, and seeing improvement or change over 1 year at follow-up. The goal of our study was really to kind of, from a global standpoint, kind of better understand how surgical intervention can affect neurologic recovery. But of course, every case is different and should be individualized in terms of when the decision to pursue surgery. There have been kind of somewhat hard and fast rules, I would say, or at least guidelines that people use to indicate for surgical intervention. Some of those are worsening decline of neurologic function, instability of the spine or the spinal column, as well as any intracanal bullet fragment. So those have been sort of the some guidelines, but overall the kind of decision-making process of whether to pursue surgical intervention is largely up to the surgeon, and there's not really very hard and fast rules beyond the ones that I just mentioned. Overall, our study found that there was 34% versus 20% improvement in ASIA impairment with surgery. And so that conferred an odds ratio of about 2 times greater likelihood of neurologic recovery with surgical intervention. We then did basically an analysis based on the region of spinal injury, so either cervical, thoracic, or lumbar, and did a subgroup analysis from there. Looking at the thoracic patients, it was about 28.8 versus 13.8%, so that conferred an odds ratio of approximately 2.5. And then in the lumbar spine, the odds ratio was about 1.7 for improvement with surgical intervention. Within the cervical group, we didn't find any improvement in the ASIA impairment with surgery. Overall, we like to think that the impact is sort of on a much more global standpoint. So before, there have been basically studies that have looked at anywhere in the 10s to maybe 100 patients at a time. This was the largest cohort at 961 patients of a very large, very rigorous, robust database on spinal cord injuries. And so I think the power of this data is in the numbers, but on the flip side and the converse is that also limits in terms of granularity. So while we do know that there has been improvement in neurologic recovery, we don't necessarily know which surgery had happened exactly and what the surgeon decision-making was for those types of surgeries. And so, in some ways, this is just one piece of the puzzle in terms of learning what are our sort of guidelines for surgical intervention with gunshot-induced spinal injuries. And so hopefully this will be part of that decision-making process for surgeons whenever they encounter one of these sort of tragic accidents,